So now I'd like to talk to you about the options of reconstruction. Of course, many women decide to do no kind of reconstruction at all, and that's completely fine. But if you are interested in reconstruction, there are basically four ways that you could reconstruct the breast. The most simple or most expeditious is going to be the tissue expander. So you can imagine when the breast or breasts are removed, the area is very flat. So in order to put an implant in there, whether it was a silicone or whether it was a saline implant, you would have to stretch the skin. So what is done is that a small little bag, as it were, is placed in day surgery underneath the skin with a little nubbin sticking out. Now this can be a problem right off the bat because it's a portal of infection. But every week for about 6 weeks, some fluid is pumped in by a doctor at the cancer center, at the surgery center, and until the skin is slowly expanded to the size that you wish. And then another day surgery happens and the bag is taken out and a saline or silicone implant is put in place. So that is called a tissue expander. The other kind of surgery that has been done is called the TRAM, the transverse rectus abdominal muscle or abdominis muscle tissue surgery, called TRAM. This surgery lasts about 8 hours, and what occurs is that tissue, including the rectus muscles, in people who have a really defined abdominal muscles, a six-pack, those are the rectus muscles. Some tissue and fat and a blood supply in the rectus muscle is used by the surgeon to create a breast. So it's your own tissue. You end up with a tummy tuck out of the deal, but you end up with a scar from hip to hip, and you end up with real, regular feeling breasts. Of course, you will not have a nipple. That is done later, either constructed or tattooed on. The problem is that the rectus muscle is sacrificed, so doing abdominal exercises will obviously not make a difference. You'll be sort of stretched, almost taut like a drum, and that's called the tram flap. There is a newer procedure called the DIEP. Some people say, wasn't that a battle in World War II? No, it stands for the DIEP, the Deep Inferior Epigastric Perforator. So it's similar to a TRAM. It's a 12-hour surgery, and it's similar, but the rectus muscles are not sacrificed. So they take tissue and a blood supply over the abdominal, below the belly button, over the abdominal wall, and using microsurgery, they create a blood supply with that flap and create a new breast. And it can be really remarkable looking, but again, it's 12-hour surgery, and there are not many surgeons, plastic surgeons do this, that do this kind of surgery. You can imagine, if you're having it done, you need a team of surgeons, 12 hours, so it can only be done one per day, but the results can be quite amazing. Now, for those women who have insufficient tissue, they're too tiny to actually have tissue taken from their abdominal muscles, there's something called the lat dorsi, the latissimus dorsi muscle behind the arm that is used to create a flap. It's not that aesthetically pleasing, but it is yet another way that you could use your own tissue for those women who are too tiny to have a TRAM or a DIEP and do not wish to have an implant. Those are the ways that you could reconstruct a breast.